Aerobic Exercise and Interval Training Prescription by Mike Greenwood, Ph.D., and CSCS with distinction.
The title of this presentation is Aerobic Exercise and Interval Training Prescription. And as we go through the presentation today, I would refer you to Chapter 21 of the Essentials text, because this is primarily where this information evolves from. But according to that chapter, exercise sustained at or above 50% of VO2 max for at least 10 minutes is considered a basic definition of aerobic training. And as we go through the lecture today, please use this as a baseline measure. What are some of the benefits of this percentage? You may be thinking that, well, 50% of max VO2 is really not a high level of oxygen consumption, and you would be right. But it does serve a purpose for individuals who maybe are just initiating a fitness program, possibly an individual who's coming off of rehabilitation, or even the fact it could be utilized for recovery or a lower intensity exercise after a previous day of hard work. But according to this definition, VO2 max is considered to be milliliters of oxygen per kilogram per minute. And there is a statement in this chapter that specifies that successful aerobic performance equals the athlete's ability to cover a fixed distance in a short period of time. Now, let's make a distinction there. This is aerobic performance, and it's not really related to health, although there are some benefits that can be evolved from that. Let's look at some goals of aerobic training then. First of all, on these bullets that we're going to look at, increase VO2 max would be a goal of aerobic training. And if we can increase that, obviously we can increase performance. Another goal would be to increase anaerobic threshold. And what we're trying to do there is be able to get the individual, once the onset of blood lactate occurs, we can have that individual work at higher rates for longer periods of time. With that in mind, we'd also want to look at work at a higher percentage of VO2 max. And again, what we're doing is providing more oxygen to the muscles to provide greater levels of intensity. And then the fourth bullet on this particular slide is an increase in muscle glycogen and lipid storage. And if you look at highly trained aerobic athletes, they have the ability to utilize lipid storage first and save glycogen use for a later period of time in competition or training. Another goal of aerobic training would be considered improve the efficiency of movement. And here we're talking about the biomechanical aspects of movement, and I will use probably a lot of definitions related to running because that's more of my background, but you can utilize this in cycling or swimming or any aspect that requires quality biomechanics, and this helps to reduce energy expenditure. Another bullet to consider for goals of aerobic training would be improving the ability to remove lactate. All of us are going to have high lactate levels when we're working at high intensity. The key factor is how do we continue to work hard once those lactate levels occur. So we'll talk about that in detail to be able to remove lactate. And then the last bullet, one that typically we don't associate with performance or training, but if you're the average person walking down the street, we want to be able to improve health risk profiles to improve quality of life. All right, let's look at some specific evaluation procedures for aerobic endurance. I mentioned VO2 max earlier. In the literature, you also see it referred to as max VO2, but primarily now you look at it in stated VO2 max. And that, again, is the maximum rate in which oxygen can be consumed each minute based on milliliters per oxygen per kilogram per minute. And there's also other components of VO2 max that are vital. Some of those other critical factors would be high lactate threshold, good exercise economy, tapping into fat stores as a fuel source before utilizing glycogen, and also a high percentage of type 1 muscle fibers. And genetically, you can thank your parents for that because you're not really going to change that aspect. But there's one other component that I'd like to talk to before I move to the next slide is revealing peak VO2. Now, what's the difference between max VO2 and peak VO2? Well, peak VO2 really is associated with a high max VO2 on a given piece of apparatus or equipment. So where you may have a high peak VO2 in running, you may not have the same VO2 max on cycling or swimming or other aspects. So peak VO2 really involves the highest attainable VO2 max on a given piece of equipment. All right, how do we relate this and how do we give this to a relationship between sport implications and applications? I always tell my students that theory is great, but we have to be able to apply the theory. So how can we use this as an application principle now? Evaluation of the aerobic fitness of athletes. We need to know where every athlete is currently functioning at. If we do not understand their functioning levels of fitness, how can we effectively prescribe an exercise protocol? So that's the first consideration always. Testing and training the appropriate energy systems. You'd be surprised, or maybe you wouldn't, a lot of times training dictates inappropriate training of the wrong energy system. So not only do we need to be sport specific in our training, I would take that a step further and state that we need to be position specific within given sports. And I'll talk about examples of that in detail when we get to that area. We also want to be able to measure athletes' oxygen utilization in minute segments under maximum stress. For me, as a former head coach and someone who works now with athletes and individuals regarding their fitness levels, how can we get people to still perform at levels when they're fatigued? How can we make sure that we have them trained effectively enough where they can still go out and perform at high levels and it doesn't hurt their skill performance? So that's another issue. How resistance to fatigue, and for me a better aspect is how fast do they recover? You know, all of us are going to fatigue when we're working at high intensity levels, but how fast can we recover to be able to go back in and perform? VO2 max is also highly correlated with the ability to run a mile. So if we are able to measure VO2 max, and I'll give you some of those examples in a minute, then we will be able to correlate that ability to run a mile. And the last bullet on this particular slide is how well a person can sustain aerobic exercise. Once you get to that level of intensity, how can we keep you at that level of intensity to help your performance outcomes? The next slide shows a pictorial of typical VO2 max percentages by various sports and by gender. Now when you look at this table, it really is not to show you the difference between males and females. That comparison is not trying to be made here. The comparison that's trying to be made here is just to show you, with different levels of intensity of VO2 max, how males perform and how females perform. So it's really not a comparative value. Males and females respond similar to aerobic training, and the key aspect here is to individualize frequency, duration, and intensity, disregarding gender. Because even if a male or female is at a certain fitness level, you want to consider those factors of duration, frequency, and intensity. But if you look at this particular table closely, you'll see different levels of VO2 max, extremely high, very high, high, above average, and average. And you'll see the differences there, for example, in extremely high cross-country skiing. Now, the part of the country that I'm from, that's not an issue because we don't have snow, but males are typically 70 mLs per minute of oxygen, and females are 60 plus. So you can see the difference there all the way down to each category. And again, there's a number of different choices for you to make here to make comparisons, whether it be basketball or soccer or rowing, but it gives you an idea of different max VO2 levels by gender. And if you had to go into the issue of comparative males and females, we know that males typically, for example, have greater muscle mass, greater force production, and more increased O2 cost as far as additional running economy. And those are just a few, just to name a few. Let's continue to look at some methods of evaluating aerobic endurance then. And I want to make the point, first of all, that there's ways to evaluate aerobic endurance in the lab setting as well as in the field. And there are some experts that contend, well, it's great in the lab, but it's not reality when you talk about being out on the field and performing on the field. And that would be a great point. But I'll look at and I'll discuss lab methods as well as some field test methods to determine VO2 max. But treadmill testing is usually used to promote higher VO2 max, and the reason being is because you have a greater involvement of gross motor muscles versus fine motor muscles. So to give you an example, if I was a disabled athlete in a wheelchair and I was paralyzed from my waist down, then I would put that person on an arm crank ergometer where they're going to be using their upper body to utilize VO2 max. Now, because it's smaller muscle groups, I'm not going to get the same max VO2 reading that I would if I was on a treadmill, just to give you an example. And what we're doing there is we're actually collecting expired gases to determine O2 consumption. And I'll talk about some protocols in just a minute, but what we're looking at is time increments, 3 minutes of increased speed and grade until exhaustion. And when we look at those factors, there's a direct linear correlation between heart rate and workload. Workload goes up, so does heart rate. And to summarize this particular slide, this max VO2 or VO2 testing gives us a baseline. It gives us a point in which to start from. And from that starting point, we're able to prescribe, which would show progression. And anytime you show progression, you're showing benefits of achieving goals, and a bigger factor then becomes motivating the athlete. Okay. You have a baseline, you show improvement, you show progression, and that motivates the athlete. Two of the most common procedures utilized to measure VO2 max in the lab setting would be the Bruce protocol, and that's suggested for younger and or active individuals. And in that situation, what we're doing is collecting expired gases. We're measuring blood pressure and heart rate. And one of the aspects involved with that is that we can measure that not just in a treadmill setting, but also with cycle ergometry or even arm crank ergometry. Now, everyone is not always ready for a true max test, so a bulky protocol is used in those situations. And the bulky protocol has smaller time increments than the Bruce, and it's suggested for older or deconditioned individuals. And again, it's a sub-max test. It's also used with patients with cardiovascular and respiratory distress. And I would caution anyone to really evaluate the health history and the exercise history of all their clients before they utilize any of these tests. We don't want to ever use contraindicated assessments that might injure someone. Factors affecting VO2 max, sometimes we're very good in our culture coming up with a number of different terms to really explain one item, and sometimes you'll see functional capacity, aerobic power, cardiovascular strength, aerobic capacity. These are all synonymous terms. So when you see these terms, they're really saying the same things. The key aspect here, and you'll hear this over and over and over in this particular lecture, is when we know VO2 max, when that's known, then we're able to prescribe an effective protocol for training. Let's look at a few physiological factors affecting VO2 max. The first factor would be aerobic capacity. And what we're talking about there is the amount of mitochondria, which is the powerhouse of the cell, in the working muscle. As we increase the mitochondria, then we have more oxygen utilization that can be put towards training and competition. Another component of aerobic capacity deals with aerobic enzymes creating energy using O2. And again, the more oxygen we can get to the working muscle, the better the performance. Another factor is capillary density. And the two components of capillary density that I'll talk about, please remember that both of these factors inhibit fatigue. So again, when you're working at high intensity levels and you're at the lactate threshold or anaerobic threshold, higher levels of capillary density will allow us to perform at high levels, continue to perform, even though we have high levels of lactate. But capillary density assists delivery of O2 and fuel to the muscle, and it also assists in the removal of waste products, which is critical for removing lactate during this time. So aerobic capacity, capillary density, and then the last component that we'll talk about, and we're just scratching the surface on physiological factors here, is hemoglobin and myoglobin content. Hemoglobin increases oxygen carrying capacity and increases O2 delivery to the muscle, where myoglobin is found in the skeletal and cardiac muscle, which also assist in O2 delivery to the muscles during exercise. This theory of hemoglobin and myoglobin that we put towards blood doping. Through venipuncture technique, we're able to extract blood and freeze it, utilizing hemoglobin and myoglobin, and then putting it back in the individual at a later time to increase those oxygen content levels. By the way, it's in competition, that's an illegal process, but that's the premise behind the theory of blood doping, increasing myoglobin and hemoglobin content. Bottom line here, from a physiological factor standpoint, we're trying to increase or improve the ability of the heart to deliver oxygen to the working muscle. And through training, recovery, proper diet, we can do those kinds of things. But the goal is to enhance aerobic capacity and to do it in a safe and effective manner. And that's a key aspect also. Now, the last 3 slides that I've gone over are, again, a brief introduction to the physiological components of aerobic endurance. Now I want to spend a little bit of time on the practical applications of this. Anaerobic threshold, the second slide of this presentation, I alluded to it, the anaerobic threshold, which is also in the literature referred to as lactate threshold, and you'll see for various reasons why, but it's an exercise intensity at which the blood lactate accumulation rate exceeds the removal rate. We're getting high levels of blood lactate, which affects performance, but the problem here is the body's not able to remove that high level at a point where it can still help the individual in their performance outcomes. But how can we continue to perform at high levels when the blood lactate levels are exceptionally high? What can we do when that occurs? And it's going to occur with everybody. It's just a matter of how we deal with that through our proper training techniques. But the anaerobic threshold training is a valuable way to enhance aerobic capacity, which obviously will help performance. But I think a key aspect here, when you compare anaerobic threshold to VO2 max, there are numerous studies that show that lactate threshold is a better indicator of aerobic performance than VO2 max is. And primarily, common sense would tell us that's because the individual is able to rid the body of high levels of lactate and still perform. And again, I mentioned that anaerobic threshold is also referred to as lactate threshold, but what's occurring is you're generating a lactic acid at a faster rate than the body can remove it. So an amazing fact to me is conditioned aerobic athletes can continue at or above the lactate threshold for 30 to 60 minutes. When the common person walking down the street is shutting it down and calling it quits, the highly conditioned aerobic athlete is still able to continue at high levels for 30 to 60 minutes. And you ask the question, why? Well, you refer to, again, chapter 21 in the Essentials text, and it talks about maximal lactate clearance. There is a buildup. The buildup's going to occur with everybody, but how can the body rid itself of those high lactate levels? How can it clear? And trained aerobic athletes have that ability. Extraneous variables to consider also are intensity levels and environment. Sometimes you're going out and you're working, you're having your athletes work or your clients work at high intensity levels higher than what they're used to. That's going to get them to the anaerobic threshold quicker. So you need to stay within the parameters that are prescribed for that particular person. Another factor is environmental conditions. When I left Texas yesterday, it was low 90s, but the humidity was like 96%. So ambient temperature. So if you're performing in those types of conditions, that's going to affect also the anaerobic threshold. That's why some athletes will go to a location weeks before the competition so they can be climatized. So they're able to put themselves in a position to perform at higher levels because they're being acclimated to a particular climate. What are some specific aspects then of anaerobic threshold? And what is the value of anaerobic threshold by sport? Well, in continuous activities such as cycling, like a 10-kilometer cycle competition, maybe lasting 30 to 35 minutes, then the anaerobic threshold is critical. But is it critical for other activities such as baseball or basketball or football? To some degree, but maybe not the same degree. When you look at baseball, and again I refer you back to my previous comment of not only is it sport specific, but it's position specific. And being a former collegiate baseball coach myself, I know my pitchers did a lot more aerobic conditioning than my position players did. So that's a situation where anaerobic threshold may not be as important as it is for a 10-kilometer cycling trial in order to get to a certain distance as soon as you can. Basketball, probably anaerobic threshold is probably more important there, but you still have timeouts, you still have free throws, so there are some breaks in the action. It's not continuous activity, as well as football. You have huddles, you have timeouts, so forth. So anaerobic threshold is important, but maybe not as important for those types of activities. And again, I used football as an example. How is it different for linemen than it is for defensive backs or wide receivers? So you have to look at specific areas and train accordingly. And the last comment that I'll leave you with is not just sport specific, but also position specific. How do we determine anaerobic threshold? What can we do? Well, why are we doing it? We need to determine the speed in which lactate builds up. And once we determine that speed, then we can effectively prescribe aerobic protocols. And if you look at some of the literature, most of the literature talks about training anaerobic threshold 2 to 3 times a week, or slightly above anaerobic threshold. So you're out there cooking at a high speed, and that's a tremendous amount of intensity. But what that might do is, for an example, have an anaerobic threshold of 10 miles per hour those 2 to 3 days a week, and that will elevate that runner or that athlete to a threshold of 10.5 miles per hour, which is obviously going to improve performance. But a factor that it's important to note here is that you need to have a proper base under you, foundational aerobic base under you first. Because if you don't, you're going to end up injuring the athlete, you're going to have performance decrements. So make sure, when it says 2 to 3 times a week, that's for an experienced, trained athlete. That's not for the person just walking down the street. So you have to have a solid base underneath you. And I'll give you a couple of examples, but I'll talk about these in more detail later with fartlek training and interval training. These are ways to enhance anaerobic threshold. Sometimes you're not always able to evaluate anaerobic threshold, so there's some indirect methods that can be utilized. And one of those indirect methods is the ventilatory threshold, also referred to as VT, but it's increased workload, increases the rate of ventilation. So we're looking at a ventilation here as opposed to anaerobic threshold. But there's a direct linear relationship between workload and ventilation until reaching lactate threshold. And again, this is just an alternative to looking at anaerobic threshold. The next slide really is a pictorial view of what I just said. On the right vertical axis, you'll see blood lactate. On the left vertical axis, you'll see VT, or ventilatory threshold, and then the horizontal axis you'll see VO2 max. And when you look at this, you'll see 2 different classifications. The orange classification is the VT, or minute ventilation, where the green classification is blood lactate. And if you look at that closely and evaluate that, you'll see that ABLA, onset of blood lactate, occurs at the same time for minute ventilation as it does for anaerobic threshold or blood lactate. So that's just another method that can be utilized to determine that. There are also a few other independent methods that can be utilized to determine threshold levels, and I'll talk about those briefly and then move on. But the respiratory exchange ratio, which is also referred to as the RER, increases oxygen consumption, and also you'll see an increase in carbon dioxide, or CO2. There's also a respiratory quotient, which is an RQ, and that is the oxygen use at the cellular level. And you need a little bit different apparatus to be able to evaluate that. And again, what we're looking at here is how is this activity correlated with the onset of blood lactate accumulation, also known as OBLA or ABLA. And again, another figure, figure 1, shows you the same comparison with an untrained versus a trained subject where lactate threshold occurs, but the ABLA, onset of blood lactate accumulation, occurs much sooner, obviously, for the untrained individual than it does the trained subject. All right, what about some methods of evaluating aerobic endurance regarding metabolic economy and metabolic efficiency? Metabolic economy it really establishes differences between individuals when evaluating O2 consumption during exercise. So again, genetics, biomechanics, fitness level. When you're comparing individuals, you have to take into account these factors and a few more. But what you're looking at here is ideal training that enhances economy of movement and aerobic capacity. And the bottom line here is that high energy economy expends less energy. When you have high metabolic economy, you expend less energy. And that provides for metabolic efficiency, which basically what we're looking at there is measuring the amount of energy needed to produce a certain amount of work. So what you're really looking at and evaluating is what's the relationship between metabolic energy expenditure and mechanical output. And I enjoy watching people run. And I always like to look at their gait. I like to see how they're carrying their hands, their body lean. All those factors go into efficiency and economy. And that will help you to expend less energy when you have proper technique. And it's the same thing in the weight room. When you have proper technique, you're going to expend less energy and get more work done, more positive work done. But what if we wanted to measure efficiency? And what we're talking about there is measuring oxygen uptake. You know, can we measure the difference between 6 miles per hour of oxygen and 10 miles per hour? Absolutely. But what we want to do is we want to look at this based on certain tasks. And measuring efficiency varies from task to task and also from person to person. And obviously it would depend on fitness level, genetics, the things we talked about, mechanics, things we talked about earlier. But how would we do that? Well, we could take the actual mechanical work accomplished, divide that by the input of energy, multiply that by 100, and that will give you your mechanical efficiency percentage. What about changes in efficiency? Well, you can have positive changes and negative changes. So if we have properly designed periodization training, like we should have with any conditioning program, and that's going to enhance aerobic efficiency. So when I talk about periodization training, proper technique, proper training and progression, starting at the proper level based on assessment and evaluation and going from that point, going into a proper progression so the person can go through the stages of the periodization cycle safely and effectively, getting to the point where they peak prior to competition. But most of you know and you're aware of the overtraining phenomenon, and that's what we want to try to avoid with proper periodization. And we talk about individualization and specialization. Well, periodization is definitely that. And that's the beautiful thing about periodization is that you can make it individual and situational specific also. But we want to avoid overtraining. Less efficiency, then we have a performance decrement. And when we talk about overtraining, we're talking about staleness, we're talking about injuries. And it's the whole premise behind the GAS syndrome, the general adaptation syndrome, is that we want to reduce injuries and we want higher performance. And you may have a great athlete, but what good does the athlete do if the athlete is injured? Because you have pushed them to the point of overtraining, to the point where they're more susceptible to an injury. So those are aspects of changes in efficiency, considerations. Metabolic equivalency, MET, is the intensity of an activity based on increments of resting oxygen uptake, and it's based on the milliliters of oxygen per kilogram per minute. And I use the example of a Stairmaster's display. Most people have been on a Stairmaster's and they have the marquee in front of them, and after they get done working for whatever time frame they're working, then you'll see a scroll across the marquee that says 16 METs. And basically, again, it's the intensity in which they're utilizing oxygen consumption. And to give you some specific examples, when we break this down to conversion tables, 1 MET is 3.5 milliliters of oxygen per kilogram of body per minute. That's considered resting. So as you sit in your chair or you lay in your bed, you're utilizing 3.5 milliliters of oxygen. If you're exercising at 35 milliliters, that's 10 METs. And if you're exercising at 70 milliliters, which is more of the elite aerobic athletes, that's 20 METs. So it gives you an idea why they're, quote, elite athletes, aerobic athletes, when they're performing at 70 plus milliliters of oxygen per minute. They're able to provide more oxygen to the muscles and to help enhance performance. And let me just say, these are just examples that I've given you. There have actually been higher levels than 70 mLs recorded cross-country skiers, for example. So this is just an example. All right, let's break this down into specifics now. As far as MET compartments, there's a resting metabolic rate, which again, remember, is 1 MET or 3.5 milliliters of oxygen. That refers to the body's ability to enhance vital functional capacity, such as heart, lungs, kidneys. So you need that just to stay alive. Then there's a thermal effect of food, which is 10% of the kilocalorie intake. That's energy used to process food, the digestive process. And then added to resting and thermal effect, you also have the thermal effect of exercise and activity. And this is the most variable component of MET because of the factor of various fitness levels and intensity levels. So this is the most difficult to really evaluate because everyone's different there. And again, there's a table that depicts these areas. It's actually leisure activities and METs and sports, exercise classes, games, and dance is the title of the table. But it shows you a number of different activities and also the average of the METs utilized in each of these activities. And you can see the higher levels of jump roping and running, cross-country skiing. Those are higher MET levels where you see things like archery and horseshoe pitching. That's an interesting one. You also have some MET involvement there, but not to the same level as some of the others I just mentioned. All right. Aerobic exercise program design variables. And most of these variables you've heard for a long time, I would assume. But the mode, I referred to the mode earlier. Mode dealing with what apparatus or activity. Frequency, how often, how many times per week. Intensity, what's the percentage of VO2 max you want to work at. Duration, how long. And progression. What can we do to improve? And progression doesn't always necessarily mean that day, but it can. Progression also means over the course of the periodization program. So let's look at each of these variables in detail now. Mode, you have to make the determination and the distinction between continuous and discontinuous exercise. I talked a little bit about that earlier, and there's a table coming up that really goes into detail about that. But continuous activities with rowing, cycling, running, again, arm crank, ergometers, so forth. You can name more probably here. But the key aspect here is selecting the mode or modes based on the individual circumstances and situations. We talk about training sport specifically. Well, you need to consider these aspects when you select your mode of activity. And again, I refer you back to peak VO2 here, not just VO2 max, because it may be, again, sport specific where you have to select a certain apparatus to accomplish peak VO2. This particular table that I referred to earlier, Table 3, which is part of your handout process in this presentation, you have 3 different levels. A Group 1 level, which is more of a beginning level. There's a constant intensity where energy expenditure is relatively low, and that would make sense at a beginning level program. But it's desirable for more precise control of exercise intensity. And we're talking about early stages of, for example, like rehabilitation, as I mentioned earlier. And some examples here would be like walking, cycling, especially with treadmill and cycle ergometry use. Because if any of you have done any training outside versus inside, you know that the environment definitely is a factor there. So at the beginning level, you may want to consider that. And that's one of the problems with people starting programs, exercise programs. They don't approach it in the proper manner. They end up hurting themselves or not getting the goals accomplished that they want, and they end up quitting. They get a little frustrated. So it's important to progress them nicely through something like this particular mode that I'm showing you here. Group 2 would be obviously in the middle of that program. Energy expenditure is higher relative to skill. There's more emphasis now put on not only conditioning but also skill development. And that would be more like swimming and cross-country skiing, those types of things. And then Group 3 obviously is the more intense program where you've progressed to that point where you're ready to move to that point. and you're looking at concerns about high risk. This type of program is very high risk for low fit individuals, so you need to be cautious there on your selection. Okay. And the examples of this would be possibly like racket sports and or basketball. Frequency. The number of times per week you can engage in a given activity, and the programs that are isolated here talk about 2 to 6 times or 2 to 6 days per week. And that's dependent upon other training variables such as intensity levels and periodization cycles. Obviously, if I'm early in the periodization scheme, I'm not going to be going 6 days a week. But as I progress through each of the cycles, I'm going to be working to the point where I do work 6 days a week based on my fitness level. And intensity is a key factor there also. But I think from a training standpoint and a coaching standpoint, you need to know your people, individualize, and know their abilities, know their fitness levels to properly assign training protocols. And again, know the difference between 2 days a week and 6 days a week, and know how intense you're working on each of those days. And there's something to be said here too about we're really notorious in our profession for doing pre and post evaluation. Let's baseline them, let's train them for 6 months, and then let's post test them. I would add something more to that. It's more than just pre and post testing. It needs to be periodic testing. So what happens if someone's not getting where they want to get soon enough? Maybe you need to go in and reevaluate. Maybe you evaluated wrong, and it's critical to have proper evaluation procedures. So again, it's much more than just pre and post evaluation. It needs to be periodic evaluation. And your challenge then becomes, is it too little or is it too much? And that only comes from knowing your athletes and being able to test them appropriately. Okay, so we move from frequency to intensity. And intensity is dealing with what percentage of VO2 max are we working at. And if that, again, as I said numerous times already, if we know what the VO2 max is, then we can calculate an appropriate training percentage for that individual. Okay, but some other accurate measures, we don't always need to know VO2 max, but it's nice, but there's some other things we can do to evaluate exercise intensity also, and that's to monitor oxygen consumption, obviously determine the percentage of VO2 max, but also be able to periodically measure blood lactate levels. Those are other factors and ways we can look at intensity. All right, early on I alluded to lab testing versus field testing. So now I'm going to talk a little bit about field testing. Not all of us are privy and have the pleasure of having lab equipment to measure VO2 max. So there's some other techniques that we can utilize, such as field test, to accomplish that goal. But I would tell you this first before I get into detail about these different types of tests, that proper test administration procedures are first and foremost. It does you no good to collect data if you're not administering the test properly. And what you're trying to do is get a max effort out of these individuals in order to get proper assessment procedures. And that's critical. And most people have heard of the Cooper's 1.5 mile or 12-minute walk-run test, but that has been shown to be highly correlated with lab procedures for VO2 max. And if you're familiar with your statistics, you know that a perfect correlation is 1.0, and those typically don't exist. But the Cooper's is a 0.98 when it's run correctly and compared to lab VO2 max testing. So 0.98 is pretty doggone good if you don't have access to a treadmill or other protocols. Now the Rockport is another aerobic exercise testing procedure, and it's a 1 mile walking test. Maybe some of you have done that or have used that. And before I go on, that's 0.96, which is not as high as the Cooper's, but it's still, and when you're in the 90th percentile, that's pretty darn good for a comparison. But one of the nice things about the Rockport that I like about, there's two aspects I like about it, is the Dalzner equation, which is utilized on the Rockport for people less than 30 years of age. And then there's a Klein equation for people that are older than 30 years of age. That's one aspect I like about it. The second aspect is the fact that it does consider age, it does consider a person's body weight, and it considers gender differences. It also considers ending heart rate to help estimate VO2 max. Just on a brief side note, a colleague of mine and I decided, well, if we get these values of 0.96 for 1 mile walking testing, what happens if we did something for a half mile, like a half mile Rockport? So we tried that on numerous occasions, collected a lot of data. Stuff has been published recently, but we still came up with a half mile, a 0.94 correlation for females, and a 0.97 for males, which is still very high. So what are the benefits of that? Well, if you've got 60 people to test, it may help shorten the time period you have to do that, and it's still a very effective measure of VO2 max. And then there are other procedures that you can utilize also, like step tests. Most people are familiar with the Harvard step test or the Queens College step test or the Ohio State. Those are all measures that you can help look at VO2 max. And then again, I mentioned earlier about max testing versus sub-max testing, like the Astran rhyming test is a sub-max bike test that can be utilized. Let's continue on with the theme of intensity then, because we need to determine, or where do we start? Well, if you remember the very first slide I talked about, please remember that 50% is our baseline. So the American College of Sports Medicine talks about 50 to 85% of VO2 max regarding intensity. And those guidelines that need to be considered there are individual levels of fitness. Obviously, you're going to select a percentage based on individual levels of fitness. Also, what about the presence of medications? If you get someone that's on beta blockers, how does that affect heart rate? And I would hope that you've done a health and exercise history prior to that, so you can determine if someone is taking medications, because that will affect their, obviously, not only their performance, but it could affect their lives. I referred to the Beckler case in Florida, where the pitcher passed away less than a year ago now, but even though they did a health history and had a medical history, the person was still able to go out and perform with blood pressures of over 150 to over 112, and that person shouldn't have been out on the field, let alone out there trying to make a professional baseball team. But you need to do your homework there, because you don't want to ever put somebody's life in danger, as well as your own careers. Also, you want to look at risk of cardiovascular or orthopedic injury. And I say that particularly with track athletes, cross-country athletes, especially with females, because there's a higher preponderance for stress fractures with those groups. And you talk about the female triad and concerns there. So those are also factors to consider. And what about individual preferences for exercise? I ask my students all the time, how many of you enjoy running? And maybe I get 2 or 3 hands that go up in a class of 30, which is normal. But you don't have to be a long-distance runner to have good aerobic fitness. There are other modes of activity you can select in order to keep an exercise adherence. And today, and for the last 20 years, we've had a term called cross-training. Back when I was marathon training and running continuously, we really didn't look at cross-training very well. And now that's another aspect for selecting exercise preferences. And again, pick your mode of activity. Which mode is the most effective for you in your sport or your activity? And again, we have Table 4, which really shows you a breakdown of aerobic exercise prescription guidelines based on fitness levels. And this whole table really is based on progression. It shows entry level, mid-range, all the way to high levels of fitness classifications. And it breaks it down according to max heart rate reserve, what's the RPE, or the rate of perceived exertion. So it shows you how people progress through each of these stages, not only with intensity, but with duration, how much time, and how often, how many times a week. But it gives you a good guideline of how much oxygen that they can utilize during these phases, as well as duration and frequency. And I should mention too, this particular table is really formatted for a 35-year-old male. And if you want to consider this for females, again, not that we're comparing, just to give you this information, you subtract 5 milliliters per kg per minute from the categories involved here. All right, let's look at intensity from another standpoint, more of a target heart rate component. And in target heart rate, we're really concerned about maximum heart rate and a percentage of that to work at. And most of you are very familiar with the old adage of 220 minus your age equals your max heart rate. And another way to attain that is to measure your actual max heart rate immediately after max aerobic exercise. So most people are familiar with that particular formula. And the next slide really gives you an example of that, where you have max heart rate times a given exercise intensity percentage, which equals your target heart rate. And the example here is a 20-year-old person, and the exercise intensity is 75%. So it's 220 minus your age equals 200 beats per minute. That's the max heart rate. And then 200 times 75%, which is the exercise intensity that was given, that equals 150 beats per minute. That's the target heart rate. One factor that this really is really void of is age is a vital factor in this formula. And as you know, there's some people that are older that are very, very fit. So age isn't always a true indicator of fitness level. Okay, there's some 50, 60-year-olds out that are competing at high levels still, where they may be more fit than a 20 or 25-year-old person. So age is relative in this particular formula, something to consider. Another formula that's probably more popular, and for reasons I'll explain in a second, is the Carbonin method. Again, we're wanting a target heart rate, and Table 5 will show you comparisons of all of these that I'll talk about. But we're talking about functional capacity is often interchanged with heart rate reserve. But it's a rough estimate of VO2 max is what we're trying to accomplish here. So heart rate reserve equals max heart rate minus resting heart rate. And that's the key factor. So we want to look at resting heart rate in this equation. And resting heart rate for most people is a better indicator of fitness level and recovery. And again, I'll give you another example. We'll use that same 20-year-old person with a resting heart rate of 65 beats per minute, and we'll also assign them an intensity of 75%. So 220 minus 20 gives you 200 beats per minute, and then 200 minus the resting heart rate is 135 beats per minute, and that is your heart rate reserve. And then we want to go ahead and multiply that number, which is 135 beats per minute times 0.75, which is the exercise intensity, and that gives us 101 beats per minute. But then we want to add the resting heart rate back into that, which is 166 beats per minute. So if you compare the Carbonin method with the first target heart rate method, you'll see that the Carbonin method is a more liberal method. It's more pure heart rate formula due to the inclusion of the resting heart rate aspect. Okay, to really try to sum up intensity now before we get into specific ways to do that. High intensity aerobic exercise increases cardiovascular and respiratory function, which is no surprise. But what's happening is we have more oxygen delivery to the working muscles. And I just mentioned this, but the main challenge here is to regulate intensity. How much is too much and how much is too little? You need to find an equal medium there to determine how to regulate intensity effectively to accomplish your goals. And a last statement here before I show you one more table is that a certain percentage of max heart rate is not the same as exercising at the same percentage of heart rate reserve or functional capacity. So if you look at this next slide, it shows you three categories: percentage of VO2 max, percentage of heart rate reserve, and percentage of max heart rate. And you'll notice VO2 max and heart rate reserve percentage are the same as you go down the whole list, starting at 50 across, but percentage of max heart rate is considerably higher. And that alludes to the previous statement that I just made on the previous slide. Another aspect which I also like, because it gives you more of a psychological advantage. In most of the studies we do, we may be collecting physiological data, but we also want to collect some psychological parameters too, is rate of perceived exertion. All of us know that there's days when we go out, we know we're fit, but we just feel terrible. We feel sluggish, we don't feel like we've accomplished a lot of things. And the rate of perceived exertion, Borg scale, can help us with that. And just for a Trivial Pursuit item here, in case you're ever playing Trivial Pursuit, the Borg scale was actually, it came from factory workers. That's where it initiated from. And then we felt like, well, maybe we can use this in our profession, looking at physiological measures. And sure enough, the RPE development came in two different levels. But what we're looking at here is different levels of somewhat hard, which is approximately 70% of functional capacity. And how is this valuable? Well, some athletes have a difficult time palpating their heart rate. So they're able to go up on the scale and say, well, I'm at 10 or 12. Okay, that's where I'm at this point, which you know they're really not at a very difficult work level yet. Other athletes have difficulty because of medications. Again, I mentioned beta blockers earlier. That's as good an example as any that could affect the way the athlete is performing on a given day. But the original Borg scale went from 6 to 20, and I'll show you that scale in just a second. The revised scale is also referred to as a category ratio scale, and that goes from 0 to 10. I would tell you, just a professional involvement here, I would tell you this, that why not use both? You know, if you can get physiological measures, great. But if you're able to use the rate of perceived exertion scale at the same time, that's just telling you more, it's giving you more data on that athlete. And here's the Borg scale that I mentioned. You have the original scale on the left and the category ratio scale on the right. And the individual is able to just tell a number, give a number, to tell where they're currently functioning at. All right, what about duration? We talked about duration earlier, but how long? How long are we going to stay at this particular fitness level? And duration is typically based on the level of aerobic capacity, and the longer the duration time is, the lower the intensity. It's just like in the weight room. When intensity goes up, volume goes down. Okay? In this case, it's the longer the duration, the lower the intensity. But we're usually looking at anywhere from 20 to 30 minutes minimum at an appropriate intensity. And the goal here is to stimulate peripheral circulation increases for aerobic athletes. So I say 20 to 30 minutes. Some athletes may need more than that based on what they're competing for. It could be more than 60 minutes at a sustained target heart rate. Just depends on what they're training for. Progression then, within one training session, proper warm-up. Now, most of you have heard since you were knee-high when you started exercising, you need a proper warm-up. And I think when you're younger, you can escape performing a proper warm-up, but as you age, it becomes even more critical. But what we're trying to do is really prepare the body's vital functions for stress. And if you have it warmed up properly, ease the body's vital functions into that, you're more at ease and more in a situation where you're going to create possible injuries. And also, you're elevating core temperature of the muscle. So you're actually preparing the body for work with a proper warm-up. And then you can get into your workout. If I've had a proper warm-up, then my workout is increased because I've taken time to prepare the body for that stress. And then obviously you want a proper cool-down procedure. But many of heart attacks that occur after workouts with older adults are due to limited or no cool-down periods or improper cool-down periods. Progression. Progression, the table that is table 7 shows an initial stage, which really the purpose of the initial stage is to minimize soreness and discomfort, just prepare the person to get a foundational base under them, and it usually runs from 5 to 6 weeks. Three times per week on non-consecutive days. The non-consecutive days are important because recovery, especially early on when you're initiating a program, you need that recovery time to go out and have a good exercise bout the next time out. But typically you're beginning at 40 to 50% of VO2 max and you progress to 70%. Now progressing to 70% doesn't mean on one given day. Remember I said it goes from 5 to 6 weeks. So as you progress throughout those weeks, that's when you continue to increase your percentage of VO2 max. And the duration can start with 12 minutes at a time and progress to 20 minutes. And just remember, this is the initial stage. This is starting the program. The improvement stage, obviously we see progression, and that's why we're talking about this topic of progression. It goes from weeks to months now. The stage length is 5 to 6 months, where the frequency goes from 3 times a week to 4 to 5 times a week compared to the initial stage. And the intensity, look at the intensity. You're actually starting at the intensity that you stopped the last progression at, which would make sense. You go from 70 to 85% of VO2 max, or even greater. And the duration increases every 2 to 3 weeks until the athlete achieves 30 minutes or more, depending on what their sport-specific goals are. And then from the improvement stage, you move into the maintenance stage, which is the last stage, the peaking stage prior to maintenance. The level that is appropriate and acceptable for the athlete and the sport requirements. So from 28 weeks plus, because it is a maintenance stage, you're dropping down in frequency to 3 times a week, and you're still maintaining a relatively high VO2 max. And that's a key thing with the maintenance phase of anything, is that you want to retain all the gains that you've made throughout your training period. Common mistake is to, once the season starts, you stop training completely. And that's ridiculous, because you want to continue to maintain everything you've worked hard over the course of the year to gain. And the duration is usually 30 to 45 minutes. And again, depending on specific sport requirements. Table 7 is really a review of the last 3 slides regarding aerobic exercise programming. And again, the emphasis here is on progression. So again, to review initial stage, improvement stage, and maintenance stage, you'll see the same type of procedures or format regarding frequency, how often, and that increases through each stage, the percentage of VO2 max and/or heart rate reserve, and also the exercise duration. And you see the progression through each stage. The next area I really want to spend some time with, and again, it's the application of the VO2 max procedures, deals with specific training programs. Long, slow distance, which is also referred to as LSD, pace tempo training, interval training, repetition training, which is also referred to as reps, and fartlek training. First program is long, slow distance, and I said it's LSD. Don't confuse that with the lysergic acid diethylamide, because it's not the drug, it's the actual long, slow distance training process. And the frequency of that is 1 to 2 times a week. The duration is greater than race distance. So whatever the race distance is, because you're working at a lower intensity, it's usually much greater than that. And the intensity is 70% of VO2 max. And in the back of your mind, you may be saying, well, 70% really isn't really that high for a trained athlete. But again, the emphasis here is long, slow distance. This is the conversation program, conversation exercise, where the athlete is able to talk without undue respiratory distress. And some of the advantages of this type of program are cardiovascular and thermoregulatory function, improved mitochondria energy and oxidative capacity of muscle, and it also enhances the body's ability to clear lactate, which is very important. And another aspect of long, slow distance is utilizing fat more effectively and sparing glycogen, which we said is an important aspect. But most coaches that I talk to about LSD, they use this particular aspect more for recovery runs. So you did a high intensity training run on Monday, for example. You follow that up with LSD the next day. So there's some endurance benefits, obviously. But some of the coaches say that if you use LSD too often, what you're doing is training people to be long, slow distance runners. So it's only used typically from most distance coaches' standpoint as a once a week type of thing for recovery. Pace tempo training is a little different, and there's also a table on all of these forms at the end, but it's on table 8. Pace tempo training is also referred to as threshold training. And there's 2 different types of pace tempo training. One is continuous and one is intermittent. And the intermittent is short recovery periods, where the steady or continuous is just that. It's straight through without any breaks. And the frequency of this is 1 to 2 times a week. Duration is 20 to 30 minutes. And intensity is at or slightly above race pace, so you know that they're working at pretty high intensity levels. And if the workout seems to be too easy, the recommendation is to increase training distance rather than intensity, because they're already working at high intensity levels. Okay, so increase the distance. Benefits from utilizing pace tempo training would include improved running economy and increased anaerobic threshold. And I haven't talked about work-rest ratios yet, but I will. It's important when people are working at those high intensity levels that you provide the proper work-rest ratio. And again, I'll explain that in a few slides. Interval training. I don't know how many of you have done any interval training, but it's a necessary evil for aerobic endurance improvements. But the frequency is 1 to 2 times a week. The duration is 3 to 5 minutes. And again, I mentioned work-rest ratios here. It's 1 to 1. And your intensity level is very, very close to VO2 max. And some of the benefits derived from using interval training are obviously increased VO2 max and enhanced anaerobic metabolism. Reps, or repetition, is another program that I alluded to. The frequency is once a week. Duration is 30 to 90 seconds. Where the ratios, work-rest ratios, are 1 to 5. Now, it does say that the duration can be less than 30 seconds, and that makes sense if you have a 50-meter person or a 100-meter person. You know, there's no need to have them out running 3 to 4 or 5 mile paces. So duration can be varied based on individual needs. But the intensity is also greater than VO2 max, so you're working at high intensity levels. What are some of the benefits? Well, obviously you can improve running speed, running economy, and also enhanced anaerobic metabolism. Another aspect of this, as well as some of the others, that it promotes kicks and pushes throughout competition. There are times when you need a burst of energy to get up a hill or pull away from a group, so it helps to put you in a position where you can do that. Fartlek training. I enjoyed fartlek training because it got me off the track. You don't always, interval training, typically you're on a track. Certain types of training you're on the track, and that can be repetitive, that can be boring, but fartlek training can get you off the track, and the frequency is 1 time per week because it is pretty intense. Duration is 20 to 60 minutes, and I've seen people go more than that. Marathoners, I've seen them go much more than that. But again, that's why you consider individual differences and training levels. But the intensity typically is at 70% of VO2 max, combined with hill work or short, fast bursts. So if you and I were out on a run, I may pick, I say, okay, the second mailbox on the left, we're going 80% to that mailbox. So we pick it up to that mailbox, and then we back off to 70 to try to recover. And then you get to pick the next point. It may be a garbage can sitting out there, or it could be a car or a telephone pole, but it makes the training go a little bit easier, and again, you're not constantly running around the track, so it just breaks up that monotony. But again, I say this a lot in my classes, particularly in my strength training classes: provide a scientific rationale for what you do. If you cannot provide a scientific rationale for a certain procedure or technique, then you probably shouldn't be doing it. If you utilize the thing, well, my coach used it, and they used it, and his coach used it, that doesn't necessarily mean that it is a scientific-based procedure. Okay, but if you can put science behind what you use, then it's probably not going to be a bad situation. And another nice thing about fartlek training is that it taps all the energy systems. And I haven't talked about energy systems in detail, but I will. But fartlek training taps all energy systems. And again, we have improved VO2 max, improved anaerobic threshold, running economy, and fuel utilization through fartlek training. And again, it gives you some variety. Table 8 is exactly what I said it would be. It just shows the programs that I just talked about: LSD, pace, tempo, interval, repetition, and fartlek training. And it gives you the breakdown of frequency, duration, and intensity. What about interval training in relation to variables? 1 to 2 times per week. What should the intensity be? Well, there's an inverse relationship between intensity and duration. I mentioned that earlier. The higher the intensity, the less the duration. All right, I mentioned energy systems, and I told you that I would allude to those in more detail, so now is the time. When a person is working at 90 to 100% of max power, they're primarily utilizing the phosphagen system. And the phosphagen system is usually bouts of 5 to 10 seconds. So the work-rest ratio then is 1 to 12 to 1 to 20. So for example, in that particular example, if a person goes 10-second sprint, That's the 1 would be 10 seconds. The ratio of recovery would be 12 to 20. So if it was 12, then that would be a recovery of 120 seconds. Now you may ask the question, well, why is there such a discrepancy between recovery here, 1 to 12 to 1 to 20? And that would be a good question, a logical question. Some people just aren't at the same fitness levels and they need more recovery time. Some people would argue, for example, in track and field, how often do you run back-to-back events immediately right after one another? Well, if you want to increase the anaerobic threshold, you need to do repetitive sprints. And that's the key aspect here. The fast glycolytic, you're working at 75 to 90% of max VO2, and that's exercise time is usually 15 to 30 seconds. And that recovery ratio there is not as much, so 1 to 3 to 1 to 5. Then you move into fast glycolytic and oxidative. It's exercise time of 1 to 3 minutes, and the ratio is 1 to 3 to 1 to 4. And again, you have a discrepancy there in work-rest ratios. And then the last system, more on the lines of aerobic, and a lot of people think just because I'm working aerobic I don't tap the other energy systems. That's wrong. You have to go through the other energy systems in order to get to the oxidative. That's typically greater than 3 minutes, and the ratio there for work and recovery is 1 to 1 or 1 to 3. So those are some guidelines for work-rest ratio for interval training. Excuse me. What about type of activity during the rest interval? I think this is just as crucial, just as critical. When you're utilizing the high-energy phosphate system, the rest recovery should be inactive. Because the phosphate system is a system that's the most easily to deplete. It's the most difficult to replete, and we're talking about inactive recovery. Now, inactive doesn't mean going laying down, falling asleep under a tree. It could be just you gently walking around, but it's an inactive recovery. When you tap into the anaerobic glycolytic system, which is lactic acid accumulation, the recovery should be an active recovery. And it's recommended that the recovery be at 40 to 50% of VO2 max. Why? Because we're trying to rid the body of a buildup of lactic acid accumulation. And fartlek training was a perfect example of that. Even though you say, hey, we're going 85% to that next marker, then you back off and recover. It's an active recovery. Now the aerobic oxidative system is also an inactive recovery. So that, again, that doesn't mean just going over and sitting down and relaxing. It could be just you easily walking, maybe doing some light stretching, that type of thing, but it's an inactive recovery. So you've got the work-rest ratios, and you have different types of recovery techniques for each energy system. What about repetitions and sets in relation to interval training? Typically begins with 6 to 7 reps and progresses to 12. And the typical maximum total distance is 1.5 to 2 miles, work portion. And I know, and I mentioned earlier, long-range distance runners usually go more than 2 miles. I know some marathoners that would do not necessarily good or right, but 20 to 25 400s to increase anaerobic threshold. But again, you have to remember they're out there for 26.2 miles. So they want to be able to maintain that sub-5 pace for 26.2 miles. So long-distance runners are a little different in their training protocols anyway. All right, in summary then of the interval training, the main theme is to increase VO2 max. And I would add to that also increase anaerobic threshold. And we want interspersing work intervals with rest intervals. If we allow rest intervals, that allows the athlete to work at higher intensities, okay, which means better performance. And higher intensity also means enhanced cardiac output, which means more oxygen to the working muscles. And the greater the VO2 max benefits, then it's greater in that sense than continuous training. If we can break it up and give interval training, that's going to increase VO2 max better than continuous training by itself. And I'd add one other aspect to that, to interval training or any other types of training that I talked about, the psychological benefits derived from this type of training. And again, physiologically we may be out there training, doing our job, but if you've been out pounding the track with interval training, you know you have a psychological advantage because you've been out there, you know what it feels like, you know what it's done for you, and that's going to come into play when you're out competing or training.
This concludes the aerobic exercise and interval training prescription presentation.